is Dr. Paul Brunson, Executive Director of the Mississippi State Medical Association. I am here with Dr. Tim Alford, actually a former president of the Mississippi State Medical Association and a current practicing emergency medicine physician. We have the opportunity to talk to Dr. Alford because he's had a pretty comprehensive experience with dealing with COVID-19, having treated a lot of patients from the outset of this, all the way down to contracting the illness himself, and now having gone through that and is back in practice. So I think for Mississippi's physicians, it would be a very interesting to get your take on what happened with you, Dr. Alford, and what this whole experience has been like, especially you being a physician and being able to see it from a totally different aspects than most Mississippians would see it from. And certainly a way to talk to Mississippi's physicians that hopefully most of us won't have the experience that you have. So can you just tell us a little bit about that?
Sure, sure. We'll do my best, Claude. Well, as I recall, on March the 11th is when Mississippi got its first case. When several of us in town, several of the physicians in town saw that, we convened a meeting of all the town leadership here, and we actually did that at the fire station on March the 16th. I think on March the 16th, Mississippi had 10 cases at that point, and we began planning our approach from a town perspective as well as from a health community perspective, how we would deal with the onslaught. We felt like that we were going to have it. We didn't quite know when and with what degree, but we knew we were going to have it. And on between March the 16th and March the 25th, when I actually tested positive, that during that period of time, I had worked 2 or 3 shifts in the emergency room. One of my colleagues, Gray Wallace, actually actually got his test back a day in advance of mine. We both began symptoms about the same time. He contacted me and said he was actually going to be tested, which he was. So the testing and all of the chronology, I was actually watching in advance of myself. He actually came back positive on a Saturday, I believe. No, he came back positive on a Friday, and I tested the very next day, and I came back positive after being tested on a Thursday. Came back positive. My results came back at 10:30 on a Saturday night. Well, we both looked back and realized we had probably gotten this from a mutual patient. And furthermore, that there were some health officials around us that had gotten it as well, even though we were taking precautions during that period of time. We were at that point beginning to wear the protective equipment, and we knew that one of the nurses and then one of the X-ray people had gotten it probably from a mutual patient, and actually probably 50 or 60 healthcare providers had been in contact with the same patient. So I actually, it was on a Tuesday, I was on my way to the post office to deliver some packages, and I was feeling a little bit under weather, and then the whole thing sort of came down on me like a ton of bricks. I've had the flu a couple of times. This was the flu and then some. At least for me it was. I knew for some reason my whole olfactory circuit just blanked out. And I'd never had that experience before, and I realized this must be, I must have this. I must have the COVID. And so at that point, I turned around. Instead of going into the post office, I turned around and went by our local premier medical clinic's testing site. They had set up a very efficient outdoor testing site at that point and got tested. And then my results came back that Saturday evening, as I mentioned. So I guess during that period, Claude, I don't know if you want to ask me. I can keep going. I don't know if you've got any specific questions for me at this point.
Yeah, well, just keep on and just tell
Okay.
tell us about your entire history,
Well,
and what you were thinking as a physician and as a patient at that point going through this.
right. So I was pretty familiar with the symptom complex, and it was all sort of unfolding right there in front of me. Um, I started having these little visions of these viruses making copies in my, in my I don't know if I was, in fact, I think in the pit of this infection, I believe that I probably was hallucinating. I will have to confess that probably in the worst part of this, one of my partners, James Withers, brought the hydroxychloroquine by, and I took 3 days of the hydroxychloroquine when I was really having fever and feeling bad. I did that as well as azithromycin, and I wasn't sure at that point whether I was um, feeling bad with headache, with some almost hallucinatory kind of thinking. Uh, I wasn't sure if that was from the fever or from the hydroxychloroquine. So, on about day 10 of my illness, I discontinued the hydroxychloroquine. Um, I would say after the onset of my symptoms on day 1, which were barely noticeable, and then day 3, when I turned around and went and got tested, uh, and, between day 3 and probably day 7 was the worst that I experienced. And um, in fact, a week in advance of all of this, back when right after we had our meeting in the community, because I felt like that I was really out there exposed potentially, I had vanished to the basement, and I had self quarantined away from Mary Al, from my and when I got away down there, um, and then contracted the symptoms a week after that. Um, uh, is was a slow onset of symptoms, and so she actually was my nurse from afar. I guess you would say she would provide meals and that type of thing. But I had actually gotten away a week in advance of the onset of my symptoms, and I'm hoping, and so far she hasn't gotten it. So we feel like she dodged a bullet, maybe because I self quarantined away from her. And I want to say probably day 4, day 5. That's when I was really having fever. That's when I was really feeling the arthralgias, the myalgias. I had no sense of taste at all. Bad headache and all the whole deal. So, and then probably day 10, day 11, I started feeling like a human being again. And the funny part about this is my daughter, who's married to Tal Hendricks, who's does orthopedics there in Jackson. She actually had a pulse oximeter sent to me, and I was thinking, I'm not going to use this. I don't need this. And it was day 9 or 10. I was feeling pretty bad. I was sitting outside. I had a fever of about 101, and was not feeling dysmic at all. And I looked down, and my O2 sat was 88. And I said, there's no way I feel this bad. I do not feel this dysmic. And I said, this thing has to be wrong. So I started moving the thing around on my fingers, and it wouldn't change. The number would not change. Well, I watched it a little bit. It kind of started creeping back up to around 88, 89%. I went down and went to sleep. And I woke up 12 hours later, and my O2 sats were back up to 95 or 96. And I said to myself, that thing must have been right. And I was probably pretty close to falling off the cliff, from an oxygen saturation standpoint. but that was sort of my, monitoring my temperature, and that was one of the objective measurements that I had, which I actually find that's probably a very useful thing for people to have at home. A good way to manage people at home if you do have to send somebody out and you know they've got COVID and you're trying to keep them out of the hospital. That's not a bad thing to have in addition to um, other elements to try to help people stay out of the hospital if at all possible. Anyway, I did start feeling better. And in fact, day 12, 13, and 14, my taste returned, fever went away. I started getting my energy level, I started getting energy back. And then I tested negative on two separate occasions, 24 hours apart on day 14 or 15. Gray Wallace and I, the other physician colleague of mine, and I were pretty much in sync as far as that test of cure. It would be one way to put it, I guess. And then I started getting calls from physicians around the state saying they knew where I lived and they wanted my serum. I told them it was for sale for $3 a gallon. No, I'm kidding. Having returned to work now and worked several shifts, I can tell you that in theory, I'm supposed to be immune. I understand that there may be some questions and there may be a little bit of a flaw in the herd immunity there, even for people that have had the virus. Maybe there are some people that aren't necessarily conveyed immunity. But my assumption, at least right now, until I can get antibody testing, is that I have a little bit better immunity than those that have not actually had the virus. Sort of the vaccine the old-fashioned way, right? But and so while I am at work, given that assumption, I do try to, if we have a potential case in the emergency room, I try to put myself a little bit out in front of the nursing staff. I do think that if I can help in that regard, I try to do that. I don't know if other health providers around the state are looking at it that way. I'm not trying to be a hero in that regard. It just it does really gum up the works. When you have a potential case in the emergency room, it slows everything down. It kind of disrupts everything, the normal flow. And I wanted to say the last time I looked, I think Attala County had 45 cases. Holmes County is ahead of us, around 60. We touch other counties. We touch Leake, we touch Choctaw, we touch Montgomery. A lot of these counties that we're sort of bleeding virus, I think, back and forth across the county line. And of course, the virus didn't know what a county line looks like. And which, in my opinion, is really why I think more of a higher altitude approach is good. And then, in our particular case, there are 4 healthcare providers that we felt like we got it from the same patient. And I'm not real sure, what the contact work was there. But so the contact tracing, I think, has got to happen before we can really begin to contain it.
Let me ask you a quick little follow-up. You said that you quarantined about a week or several days before you got symptoms. What cues did you have there?
Well, the cue was that I was watching people like Fauci and Schaffner from Vanderbilt and some of those people, and reading that in all likelihood, if you saw it coming into your state, then in fact you had gone from an epidemic to a pandemic to an endemic, and then we were probably endemic on the first case on March the 11th. And on March the 16th, I even tried to convince our city government, let's don't do this meeting in a cramped fire station room. Let's do it in a big wide open church sanctuary where people can sit down and be apart from one another. So it was really a couple of days in advance. I just sort of had a bad feeling. And Mary Al and I looked at each other and I said, I don't know. This thing is obviously in the state, and we might. And she keeps up very well too, and so she had no problems with me going to the basement, and she cooperated real well with that. I kind of looked around and go, well, but anyway, because I had to, it was one of those decisions where physically separating and leaving from the upstairs and going down into the basement. We just made that decision, and that was on the 16th. And then I think probably 8 to 9 days later is when I began to develop rather subtle symptoms. And then 3 days after that, boy, it came down on me like a ton of bricks. And I don't know. I think that was a fairly fortunate move on our part. It was a mutual decision between us both, and hope, at least for the moment, things had paid off. I know Gray Wallace in his situation, they were actually sitting down and watched a movie on the Sunday night and ate popcorn out of the same bowl, he and his wife and daughter. And then on Monday is when he actually felt so bad, he went and got tested. So it hit us in a slightly different time sequence, but certainly our immunities were different, and we felt like we got it from the same patient.
Well, this is it's been very interesting hearing your recount of all this. What are there any pearls or any things you could tell Mississippi's physicians to be on the lookout for, to be aware of, or things that we wouldn't just innately know or feel as physicians, but we could probably understand getting it from you because you had the ultimate experience with this virus?
Well, I really don't, I don't know the fact that I've contracted the virus makes me any less or more qualified to talk about it. Certainly, having the experience makes me more sympathetic. I guess in retrospect, I would be considered a mild to moderate case. And I'm thinking these poor people that actually have to go on and have oxygen support and then that incredible cytokine storm. I'm thinking that I had a little bit of that at some point. Certainly my face felt like I'd been outside on a 4th of July laying on the beach for all day long and then run a marathon. I mean, it was a fairly intense feeling. I think I was having some of the evil humors that were coming out, but nothing like a lot of the people are having. I do think sort of when you go through a differential in your head, you're thinking about what people could have. Certainly, the demographics of patients. We were originally thinking that this was going to be somebody that came in from a foreign trip. Now we know that this virus is very much among us, and it's affecting the African American population differentially and in a real bad way. So the concern for now, I'm looking, at the beginning of this, I was looking at a young African American that came into the emergency room with fever. I said, there's no way this patient has corona. And now I'm looking at that patient and thinking there's a great likelihood that this patient has corona, especially if they've been working in a chicken plant, for instance. And so I do think we're going to continue to learn about this. I think over the next 10 years, we're going to be piecing all of this together. And the people that are really up on this as far as understanding the code of the virus um, is we're going to continue to learn, and the forensic trail to look back and figure out where these cases came from, and how they got to us. I'm I'm just I'm hopeful that somehow the efforts to accelerate therapeutics and virus research, that those that you, we here in America will figure out a way to do it quicker than we've ever done it before. That's what's going to, I think, take the foot off of our necks. Economically, is an honest to goodness. There's a difference between foolish optimism and real hope. Real hope, you understand exactly how deep the problem is, so I think we have to be careful and really try to lead political leadership in a way that is honest and forthright. And I'm glad that if we have to take this in baby steps as far as opening back up, um, then so be it. But I do think, in our town, we've got a mayor here that got it. The mayor said, look, he said, I do tornadoes, I do floods, I understand ice storms, we can do down power lines, but I'm turning all of this pandemic stuff over to our local providers. And uh, when we realized that the shutdown happened, I rode by our high school, and there it was just taped off almost like a crime scene. Well, that was a powerful symbolic message that got sent to the community at that point, that things were different. We've all got to behave differently. This is a serious deal. And it was that's then a very powerful signal. That was something the mayor did with our school superintendent. And so it really does require a comprehensive connection. We have to be giving them the science, and so that they can make the right moves. And we can't sugarcoat it. We've got to be honest, straight down the line on this. And you know, um, and that would be what I would say to everybody. Look, you have a powerful voice in your community. Physicians do. Use that voice. Stay connected with the public health community. Understand what the CDC is telling us. It is pretty much a consistent message, but it has morphed a little bit over time. Be that voice, and don't be afraid to say something to the local Walmart manager where they need to slow down the flow of traffic through the Walmarts. That's one of the things that we noticed here in town, that some of the moves that we're making, they were actually compressing time. They went from almost a 24-hour cycle to a 12-hour cycle. Well, what happened in that case? That put people closer together in the checkout lines, rather than the social separation, physical separation. They were trying to do the right thing, but in reality, it was the social distancing aspect was aggravated by some of their scheduling moves. So that's sort of my take on it, Claude. I hope that's helpful, and I appreciate your reaching out, and maybe some of my comments will be of help. Again, I just because I've had this virus doesn't make me any more or less qualified to discuss it. But you know, I appreciate the opportunity to speak to you.
Well, thank you so much, Dr. Alford, for letting us visit with you, and letting you talk to our physicians. And let me, on a personal note, thank you for all the leadership that you've shown here in organized medicine through the State Medical Association, but also, as you say, in your town. And we talk about physicians having the ability to lead and to step up, and that folks will naturally want to hear what you have to say. And you've been an example of that throughout your career, and you've mentored me during my career in medicine, and certainly in organized medicine. And so, on behalf of the State Medical Association and Mississippi's physicians, we do appreciate all the leadership you've always shown, and we do appreciate you being willing to sit with us and go over your experience with COVID-19. So thank you.